Hello, welcome to Healthy Eyes Hub. In our previous video, we talked about some interesting facts about diabetes mellitus. Today's video will focus on types of diabetes. Please like, share, comment, and subscribe to this channel if you haven't already. Also, press the notification button to receive more updates when new learning materials are uploaded. Let's begin. There are two main types of diabetes mellitus. They are type 1 and type 2 diabetes mellitus. Type 1 diabetes was previously known as insulin-dependent, juvenile or childhood onset diabetes mellitus. Type 1 diabetes is known as juvenile diabetes because it's usually diagnosed in children under 14 years, but it can be diagnosed much later than this age. People with type 1 are insulin dependent as their bodies are unable to produce insulin, so they need to inject it regularly until a cure is found. Type 1 diabetes is characterized by deficiency in insulin production and requires daily administration of insulin. In 2002, there were about 9 million people with type 1 diabetes. The majority of them live in high-income countries. Neither its cause nor the means to prevent it are yet known. Now let's move on to type 2 diabetes, the second type. More than 95% of people with diabetes have type 2. Type 2 diabetes was formerly called non-insulin dependent or adult onset. Until recently, this type of diabetes was seen only in adults, but it is now also occurring increasingly and frequently in children. Type 2 diabetes affects how your body uses sugar or glucose for energy. It stops the body from using insulin properly in a way that the cells of the body are unable to utilize the glucose in the blood. This leads to high levels of blood sugar, which requires management. Over time, type 2 diabetes can cause serious damage to the body, especially nerves and blood vessels. Type 2 diabetes is often preventable. Factors that contribute to developing type 2 diabetes include being overweight, not getting enough exercise or sedentary lifestyle, and genetics. Early diagnosis is important to prevent the worst effects of type 2 diabetes. The best way to detect diabetes early is to get regular checkups and blood tests with a healthcare provider. Symptoms of type 2 diabetes can be mild. They may take several years to be noticed. Symptoms may be similar to those of type 1 diabetes, but are often less marked. As a result, the disease may be diagnosed several years after onset, after complications have already arisen. Other types of diabetes mellitus have been discovered, but we will throw more light on one of them, which is gestational diabetes. In gestational diabetes, blood glucose levels are high, above normal, but below the level that is diagnostic of diabetes. Gestational diabetes occurs during pregnancy. Women with gestational diabetes are at an increased risk of complications during pregnancy and at delivery. These women and possibly their children are also at risk of type 2 diabetes in the future. Gestational diabetes is diagnosed through prenatal screening rather than through reported symptoms. Yet this type of diabetes may resolve after delivery with appropriate management. In our next video, we will talk about the reason behind the classical signs and symptoms of diabetes and how diabetes affects the human eyes. Please like, share, subscribe, and press the notification button to receive more learning updates. Thank you.